this is Paul Isaacs. This is my third video, and this will be focusing on OCD and Asperger's and trying to differentiate obsessive compulsive disorder and what that is between an autistic obsession. Now, interestingly enough, my mother was diagnosed with OCD also at a young age, and I developed this condition as well. This started off at school, at secondary school, with hand washing. It started off as hand washing and counting as I washed my hands, to the point where the water was boiling, you know, hot, very hot water. And I can remember doing this in the dressing room after PE, and some person saying to me, "Paul, you realise that, you know," I can't remember exactly what he said, but he commented on the water being hot and all this steam coming out of the basin. Another product of this disorder is obsessive compulsive disorder. Is I had a phase where for some reason before I went to school, I feared being ill, getting a serious illness. And I can remember before I went out to catch the bus, I would list verbally to my nan that I won't get this, I won't get that, I won't get this or the other, and so on, and she'd have to agree with every condition I was worried about getting before I went, as a comfort. Another continuing trait is unwanted thoughts and intrusive thoughts that come into one's head. These are things I still deal with now, and these can be very, very tiring and very anxious when you're out and you get these intrusive thoughts, and these are unwanted. Ironically, people who have obsessive compulsive disorder are very moral, very nice people, and then usually what happens is the opposite of that comes into the person's head, and it creates a conflict, an internal conflict as well. Another one that is still retained occasionally is checking doors and checking plugs. That happens sometimes when I have to leave the home. Sometimes you get this irrational fear that the house is going to burn down if you don't unplug it from the socket. That can cause anxiety and just worry, and you get annoyed with yourself. Now, that's a compulsion. That's almost a need to do something that makes you anxious and makes you feel on edge. That is different from an autistic or Asperger's obsession or hobby, which is something you enjoy, and you get the exact opposite from an autistic obsession. It's therapeutic, it's enjoyable, it makes you feel calm, and I feel one has to differentiate between OCD and Asperger's and the obsessions of Asperger's, but I have no doubt that these two conditions do go hand in hand, and I'm sure there are people with Asperger's and on the autistic spectrum who have this, as well as the social emotional agnosia I said in the last video. But anyway, it's something that is prevalent, I think, with autism, and thanks for listening. Thank you.